Hi, everyone. My name is Debbie Cox-Bolton. I'm CEO of the New Deal, and I want to thank you all for joining us and welcome you to this special call that we're very delighted to co-host with our friends over at Third Way. Jim Kessler, the Executive Vice President for Policy at Third Way, will be moderating, but it's my great pleasure first to just say welcome and to introduce some folks. I wanted to just say first, however, that the New Deal's mission has always been to discover and to nurture exceptionally talented, thoughtful, and effective leaders. Never before has that work been more vital. These leaders are on the front lines of the pandemic, and we've turned our attention to how we can best support them in their efforts. We at the New Deal have launched a database of best practices at the state and local level. We're convening leaders and experts to share real-time information and solutions. And this very week, we sent up to Congress recommendations based on their suggestions of what they need to be able to both fight the virus and to get our economies back on track. So I'm excited today to introduce you to three of our New Deal leaders who are really making a difference in their communities. First, Wisconsin Lieutenant Governor Mandela Barnes has been a New Deal leader since he was first in the state legislature. Elected to his current post in 2018, Mandela became the youngest lieutenant governor in the country. He's already become a national leader on issues around racial inequality and climate, and we're very lucky to have him as one of our co-chairs of our climate change working group. Margaret Good is a state legislator from Central Florida who flipped a Trump district in 2018. She's currently running for Congress in Florida's 16th district, and I know if anyone can flip that seat, it is Margaret. She is a leader nationally on issues like the environment, on workforce development, and on Medicaid expansion. Eugene DePasquale is the Auditor General of the state of Pennsylvania. He too is running for Congress in Pennsylvania's 16th district, I'm sorry, it's Pennsylvania's 10th district, and that is a Republican-held seat that the Cook Report currently rates as a toss-up because of his candidacy. Eugene, as state auditor, has been a leader on fiscal discipline and government transparency. He helped fix the state's child abuse hotline and has helped improve the state's response to the opioid crisis. So with that, it is really my absolute pleasure to introduce you to three amazing New Deal leaders. And I'm going to turn it over to Jim to moderate today's call.
Wonderful. Thank you so much, Debbie. It's great to see you. And thank you to the New Deal. And for those who are on this Zoom and aren't familiar with New Deal, it's a spectacular organization. Google them, check out what they're doing. This is really like next generation of terrific Democratic leaders, and we've got three of them here today. One quick piece of housekeeping. I'm going to be asking some questions to our three guests, but you can ask questions too. Just move your cursor, a box should pop up, and it will give you an opportunity to ask a question, to pose a question that I will then ask online. Okay, so let's get started. Good afternoon, everybody. So we have three elected officials from three critically important political states, Pennsylvania, Wisconsin, and Florida. We win those states, Joe Biden's president, you know.
Yeah, those are three boxes. If we check them, we're doing pretty well.
Yeah, that's it. You know, we can go home. If you look at the takeover, the Democratic takeover of the House, Pennsylvania and Florida, 6 of those seats were flipped. That's critically important. We're hoping to flip another in Florida. Wisconsin just had a statewide election in the midst of a pandemic that Republicans thought would go one way, but it went another just a couple of weeks back. And of course, we're having this discussion in the midst of a full-blown peak of the COVID virus. And frankly, these three states are having different experiences with the virus. And I want to get to that with all of our guests. And I also want to make sure we touch on the racial disparities of the COVID epidemic, because it's really concerning and notable. And I think it's wrapped up in some of the political issues that are going on here. So let me start with this question, which I'm going to ask to all of you. And let's do it in this order. Let's start with Lieutenant Governor Barnes, then Representative Good, and then Auditor DePasquale.
All right. Thank you.
Let me just
Sorry about that.
pose this. 318 people have died in Wisconsin from COVID deaths since March 1st, 318. 479 Pennsylvanians have died from COVID deaths in the last 48 hours. And Florida has had 97 deaths in the last 48 hours, which is low compared to Pennsylvania, but it's ramping up. So there's enormous pressure to open up business. Trump wants to open up business. Some of the governors across the country and in some of the states here want to open up business. Is your state ready to open up business? And let's start with Lieutenant Governor Barnes.
Yeah, thanks so much. I got a little ahead of myself.
It's okay.
We talk about these things so much, and I love to just kind of get into the discussions to talk about everything that we're dealing with and how we're working to combat that. But to first answer the question, I would say no, states aren't ready to just completely restart. And I think that there's a distinction too, because just simply reopening doesn't mean that everything's going to be restored right away. And I don't think that's taken into consideration. You can open up every restaurant tomorrow. Doesn't mean people are going to be lined up around the corner or filling seats in those restaurants. But in Wisconsin, we're seeing the devastating impacts of the virus like many other states. As of yesterday, we've had over 6,500 positive cases and 300 deaths. And we continue to see the disproportionate numbers of Black and brown people in our state being impacted. And I'll talk about one of the more unfortunate things too, is the fact that a lot of people's real struggle is being exploited. And we saw that with the protests that took place here in Wisconsin, similar to the ones that were in Michigan and other states as well. And they get the feeling of being more like, political protests, political rallies, not necessarily about coming up with the solutions to improve people's lives who are dealing with the COVID-19 pandemic that we are all experiencing. And the most unfortunate part too is the fact that the people who are being the most impacted, the ones who are losing their lives, the ones who are seeing the highest rates of transmission, those aren't the people who are being represented at those protests. So it's important for us to not necessarily think about how we necessarily reopen, quote unquote, but how do we adjust in this time period? I think that's a more important conversation, because it can't just be a simple reopening. But that kind of stuff is evidenced like in meatpacking plants in Brown County here, where Green Bay is located. And, the number of cases is less because it's a smaller county, but their rate of positive test cases per 1,000 people or per 100,000 people has eclipsed that of Milwaukee County. Yeah, and wow. At that meat processing plant, we're talking about a large immigrant population, another community that continues to be disregarded and forgotten when a lot of the decisions get made. And one of the bigger things too that has to be considered is the fact that the first relief package didn't hit small businesses the way that it should have. And are they ready to deal with the impact of the pandemic? I'm not sure that they are. If they were to open their doors and then we see another spike in cases that we have. So we have challenges here. We are not ready to just jumpstart and get back into the way things were back in early March or February and life before COVID as we know it. Simply just not ready. But we have to have a plan that allows us to adjust. And for the first time ever, I can say that the plan that we're working on here in Wisconsin somewhat mirrors the White House. I don't know how many times I'll ever get to say that again. Hopefully after November, I'll never get to say it again. But
it makes me very confident.
Yeah, I know. But our Badger bounce back plan, there's a few metrics that have to be met. We don't even have testing capacity like most other states across the country. We don't have a mechanism in place that will allow for adequate contact tracing. And we haven't seen a decline in the rate of infection over a 2-week span like we would need to comfortably begin to reopen the open up parts of our state. And I've started saying opening up the state more instead of opening up the economy, because the economy is open, but a lot of the failures, a lot of the fissures that exist are being exposed in the economy right now. And there's been a push by some Republican lawmakers here to open up on a regional basis where there is not as much transmission. And it sounds good, right? Like, sure, it sounds great in theory, but if you think about it, that's just opening up parts of the state for people to show up to. Like, what's going to stop people who are infected from showing up to these areas? And the asymptomatic transmission, people who aren't going to be doing this on purpose, but people who will be, transmitting asymptomatically could potentially be showing up to these places and making it even more difficult in rural parts of the state where that hospital access isn't there for them to be able to get treated and cared for. So no, I don't think we're not there just yet, but it's important for us to figure out a transition and an adjustment period that should take place at this moment.
Thank you. And I did look at the CDC guidelines, which I think is what you were referring to from the Trump administration and the federal government. And they're very good guidelines. I mean, that came from the CDC, they're professionals and they're experts. Representative Good, Florida, been criticized for maybe not taking this as seriously as others, but Sunshine State ready to open for business.
Jim, Florida has been in the news a lot lately and not very often for good things. Our governor was one of the last of the governors that had significant outbreaks to really take it seriously. And now we are moving towards reopening. Our governor just yesterday put out an executive order that opened restaurants to 25% capacity with 6-foot social distancing. And there is a lot of economic pressure in Florida, both from big businesses, but also because our unemployment system is so dysfunctional and so broken as a result of the 22 years of Republican rule and the lack of prioritization. The system was created to make it difficult to apply for unemployment insurance. And when the system's overwhelmed, it just makes it that much harder. So we've had constituents that we've been talking to for 5 and 6 weeks that still have yet to get an unemployment check and should be eligible. So there's a lot of economic hardship in Florida right now that feels in some ways like it's eclipsing the public health crisis, but we can't let that happen because we know how important public health is. And without the testing, we just don't know if we're ready to open. And Florida, the guideline is that about 33,000 people should be tested a day in Florida. At our peak, I think on April 23rd, we tested about 23,000 people. Yesterday, we tested 11. There's not a lot of transparency around those numbers. Sometimes if you're getting tested twice, like there's the guideline that you get tested once and then you need to get tested 14 days later. Those tests are counted, so it's not necessarily 23,000 individual people. Some of those could be the second test. And we've also seen a lack of transparency with respect to the death rate in Florida. The story just broke yesterday that it looks like we may be 10% underreporting our deaths. And so without the real evidence, it's hard to know where our state is and where we should be on reopening.
Auditor, you've been very active both on the business end, overseeing the state, and also 3 years ago, you issued a report about the unemployment system in Pennsylvania and saying that the architecture, again, under a lot of years of Republican rule, but the architecture really wasn't ready for a big time recession. Is Pennsylvania ready?
So thanks, Jim, and thanks to my colleagues that are all I agree with each of their answers. Start off with no, Pennsylvania is not ready to just have a mass reopening. This is an area where I think, at least clearly for the bulk of elected officials versus the public is ahead of the politicians on this. Mm-hmm. I've seen it in opinion survey after opinion survey where the people are saying before, even if the economy were to open up in mass right now, the public is not going to take part in that until they feel that there are appropriate safety protocols anyway. And that's not a red or blue issue. That cuts across ideological divides, partisan divides. So we are not ready to open up right now. In addition to that, and I think the Lieutenant Governor talked about this a little bit in his answer, the idea that we can open up one part of Pennsylvania, say hypothetically Philadelphia, and they would be one of the later ones, just how they're doing right now, and think that doesn't impact Philadelphia suburbs or York or Harrisburg is fantasy land. Look, we are surrounded by, Maryland, Ohio, New Jersey, Delaware, New York, West Virginia. Those are the states that surround us. And our governor has been working in concert with those other regional governors. And, as we've also been working with regional auditors as well, trying to look out for taxpayers in this. But the reality is, if something is happening in Baltimore or in York, which is, we are only 40 miles apart or 45 miles apart. If we do something wrong in York, regardless of what the state boundary is, or something happens bad in Baltimore, again, regardless of the state boundaries, that's going to clearly impact both of our regions. So the idea that this can just happen in mass without having any impact on surrounding regions and states is clearly fantasy land. So we've got to work together to reopen in a smart way based on science, health data, and understand that we can't let the window dressing drive this. I think it was Texas, where it said, well, we're going to allow restaurants to reopen, but only 20% occupancy. Look, I grew up in a family that owned a restaurant. 20% occupancy is, again, fantasy land. So that in my parents' business, that meant that you could have 4 tables. Well, so to keep the light bill on, to pay whether it be the air conditioning or the heat bill or whatever it is, have the bartender, the wait staff, and the cook there, and you're only allowed 4 tables. And again, I'm not suggesting they should allow everyone in, but that's just window dressing. That's not really reopening, and the public's not going to want to go there anyway. So we've got to be smart about this, make sure we've got tracing capabilities. We've got to work on testing, and hopefully sooner rather than later, having some type of way to prevent people from getting this dreaded virus. Now, specifically on the unemployment compensation system, I did an audit in 2017, and we showed that the system was run on COBOL. For those of you who are not aware, I don't know what the age is of everyone listening, but if you went to high school in the 80s, you know what COBOL is. And if you're sometimes a sci-fi nerd like me, it's a planet in Battlestar Galactica. If you're young, you're probably shocked to find out that any type of computer system is run on COBOL. But our unemployment compensation system is, because there was never a priority on fixing it. I said in 2017, after our audit of it, and I wish I were wrong, that the next time we have a recession, this system will implode. Well, here we are. And I think that there was a lack of investment of it from the General Assembly, even though the governor fired the vendor and is trying to get a new system up and running, but the lack of investment likely due to, because up until a couple of weeks ago, we were at near full employment, so this was just not a priority. Well, now we've got a real problem here. There are people, and these are heart-wrenching stories, trying to get through 900 phone calls from one individual just to get through to file their claim, just so they can get money that is legally owed to them. That, people that have done what they were asked to do, which is shut down temporarily so that we could stop the spread of this virus, doing exactly what they're told to do, regardless of party, regardless of ideology. And now they are paying the consequences of not having a computer system in place that can get them that benefit that they need to stay in, whether it be their home, their apartment, put dinner on their table for their family until we can reopen this economy. It's entirely unconscionable.
I want to touch on sort of what I'm seeing is kind of 2 competing partisan impulses that I'm noticing throughout the country, and I'm wondering if it's happening in your state. So on the one hand, Congress is having its usual squabbles, but in a bipartisan way, they've done more in the last 6 weeks than they've done really in the last 20 years. So you're seeing, things getting done. They're reaching agreements. Then today, I see a story. Lindsey Graham of South Carolina talks about this, that if people don't go back to work in states where you go back to work, we're going to take their unemployment benefits away from them. And starting to hear that from governors as well. And the idea is like, look, if you're not going to go to your $13 an hour job, slinging hash or working in a meatpacking plant, we who sit behind our desk and work from home, we're going to take your checks away. So what I'm wondering, and let's start with you, Representative Good. In Florida, where you're trying to deal with this problem in real time, and has been a traditionally very divided state politically, and so is Pennsylvania, and so is Wisconsin, are the parties working together, or do you see now a point where they're going to start pulling apart because different parts of the state feel very differently about whether this is a health crisis or more of an economic crisis?
Yeah, I know our own Senator Scott wants governor that who created our unemployment system, has made similar type of comments about the unemployed, and that we don't want to give them too many benefits because they won't want to go back to work. I think that is a completely false narrative. That is, I mean, it's just absolutely untrue. That is not how Floridians operate. That's not how we think. But I also, I mean, one of my main concerns about mass reopening is that, you know, the governor will issues an executive order, or the, you know, non-essential businesses start going back to work. And so you're not eligible for unemployment benefits anymore. And so then you have to make a really frightening choice about, you know, whether or not you want to take your own personal health at risk to go work at TJ Maxx, or if you want to stay home and not be able to feed your family. And that, I'm really afraid that we are setting ourselves up for people to get sick and not have any recourse, and not be able to get the unemployment benefits, the relief that they need in order to make the decision that's best for them.
Right. If you've been, let's say, in contact with someone who's tested positive, it's like, oh, well, I'm supposed to go to work here. Auditor DePasquale, what are you seeing about partisanship in Pennsylvania on this? How is that kind of playing out in response?
I think you have to view two things. First, maybe how the elected officials are viewing this, versus how the public is viewing it. And regardless of party, I'm not convinced that there's a partisan divide with the general public on this. Look, certainly one of the reasons why you're seeing racial disparities on this, and certainly people on the low income scale that are working, is they can't do what each of the four of us are blessed to do. I've got this, you know, I'm the state auditor general. I get to work from home. I've got this great Wi-Fi system. I can do Zoom calls with you and on my official work. I can have a press conference with literally 7 TV cameras following me while I'm doing this, while at the same time having a son who's still able to go to college, even though, and the lieutenant governor will be happy to hear this, you know, he's a student in Wisconsin, but back here now. So congratulations, Lieutenant Governor, on getting some of my money when he's out there spending, when he at least was on campus. But he's able to do college from our couch here now. And my daughter's a high school student. We have, again, all the technology so they can do that. Not everyone has that capability. And the idea that someone's going to work in some distribution plant or some meatpacking plant or some manufacturing sector where that employer may not have all the safety protocols in. And again, I'm 48. Knocking on wood, I believe I have none of the underlying health issues. I'm, you know, at least again, to the best of my knowledge, in very good physical condition, so that each of the things that could potentially make it so that it's more dangerous for me don't necessarily impact me. But we now know about 48% of adults in the United States have one of the underlying symptoms that can make this virus more deadly for them. So that we're going to say, hey, yeah, go back to that job where the employer isn't taking physical distancing seriously. I like to call it physical distancing, but social distancing, where they're not taking it seriously, where you're going to put your health at risk. Oh, by the way, we're not going to, you know, help you get additional health insurance. And oh, by the way, if you don't do that, we're going to take your unemployment insurance. Okay, this is where we've got to be smart and strategic about opening up the economy. Again, I want to go back to baseball games too. I want to be able to see a Major League Baseball game too. But we got to be smart and strategic about this. But punishing our lowest income workers because we, in the collective we that are able to do some of our jobs from home, are able to do our job, to me is so out of touch, it's beyond words.
Mm-hmm. Governor, there's obviously been some partisan issues in Wisconsin, most recently with an election that was held over the objection of Democrats. The result was not what Republicans wanted, and they held that election seemingly because they thought there would be low turnout in African-American areas, more crowded areas of the state, and people actually risked their lives to vote, which in some ways is sad and in other ways is heartening. Is there, in Wisconsin, in response, does it feel like a partisan wrestling match, or does it feel like the state is coming together?
Oh, it's absolutely a partisan wrestling match. even if you look at the order that the governor issued to delay the election, they immediately went to the court to settle the matter. And now they are challenging our safer home order. They're challenging that extension to try to get that lifted. And like the Auditor General said, like, there are things that we want to do. I trained for a marathon I couldn't even run. You know, I want to host a DNC. There's so many things that I want to do, right? Like just activities that are up in limbo at this moment. And like Representative Good said, you know, when she talked about the unemployment piece, I don't know a bunch of people that chose to get laid off. And when people got laid off, they also lost their health insurance benefits. So anybody who's suggesting that people are making more money now that they are collecting unemployment, that's false, especially if you factor in everything else that these folks are missing out on, not to mention job security. Who's even say that job's going to be around, you know, on the other end of this. So it's unfortunate that it has become this political wrestling match, because it absolutely should not be. And I hate that we're in this place, because it is turning communities against each other. And there's always been the urban-rural divide that I don't even subscribe to as a real thing. I look at it as a political ploy to divide people, to keep us separated, to turn us away from acknowledging our common interests that we all share. But they are, again, a lot of folks are using that to drive more wedges between different parts of our state. It's not fun, it's frustrating, and people should be ashamed of themselves for doing it.
I want to move to the question of race and COVID, because it's really striking. If you live in a county that is at least 30% Black, so that's basically twice the Black population as the nation as a whole, the COVID infection rate is 5 times higher than if you're living in a county that is 85% white. And if you're in a county that's 30% Hispanic, it's 3 times higher than if it's a county that's 85% white. You look at a state like Wisconsin, which has, compared to other states, is doing so much better on COVID deaths and COVID infection rate, but not Milwaukee. It's got 60% of the COVID deaths there. So let me start with you, Lieutenant Governor, because you've really been vocal on this, even before the crisis, about disparities, health disparities, and race. What is this telling us? What lessons should we be learning from this?
Yeah, you know, the pandemic is shining a light on the disparities that already exist. People who don't have access to, you know, quality healthcare, the communities that, by and large, don't always have a primary care physician, or decline to go to see a doctor if they aren't feeling well. They are seeing the impacts of this worse because that health maintenance hasn't necessarily been taking place. And there are also some other reasons too that are, you know, much more structural: distrust of the healthcare system, you know, and also distrust of medical providers. And there are certain links that show outcomes in healthcare that predate COVID-19, that show links between people who tried to get care, didn't get the care that they should have gotten. I mean, there were some really, really heartbreaking stories of people who were in an ambulance and they weren't admitted to a hospital and died in a parking lot. We had the highest rate of infant mortality here, Black infant mortality here in the state of Wisconsin. So the underlying issues that center around race, they typically are tied to economic well-being and access to just basic necessities, you know, that prohibit folks from experiencing a quality of life that would have helped them, you know, that would have helped communities be stronger during this pandemic. So some of the structural issues that we have to absolutely take on. I mean, I've been trying to take this stuff on for forever, but people ignored it. And now the question has been asked, well, how is this happening? It's like, the answer is there. We know how it's happened. It's because of the injustice that has existed before the pandemic. The pandemic just made things worse. And, you know, hopefully people start to take notice now and recognize the need for communities to be whole. Means that they need to have access to healthcare. That means they need to have a family sustaining wage and the jobs they
Representative Good, I want to ask you a question that came from the audience, which is, and I think in some ways is appropriate to Florida because it is, because of the governor, one of the states that was most aggressive about getting things back to normal, okay? Okay, business is open. Will people show up? Will people be going to the restaurants? I know people will be going to the beaches, but beaches in some ways are different, okay? That's like taking a walk. And what will it take to get people to show up? Auditor DePasquale said the people are ahead of the politicians on this. You know, they're staying at home. So what do you think it'll take for people to come out, regardless of what the governor says?
I think that's a really good question. In my area, you know, in Southwest Florida, Sarasota, Manatee, Southern Hillsborough counties, we have one of the highest elderly populations in the state of Florida. And, you know, of course, Florida has a high elderly population anyway. And I think that community in particular is paying a lot of attention to what the health experts are saying and are not willing to come out of their house to go sit in a restaurant at this point, and are really looking for, you know, testing and transparency are two of the things that, as I've mentioned, that we really struggled with in Florida to make sure that, you know, that we have enough testing, that it's getting turned around quickly enough, that we're actually reporting the numbers that of people that are being tested and the positives. And I think that until we have real widespread transparent testing, people aren't going to feel comfortable, and it may even take longer than that for people to come back out. But certainly, you know, I know people around here, it's beautiful in Florida this time of year, getting stir crazy. There's lots of people that have taken up running and walking, and our beach, our county beach opened last week but not the parking lots. They're opening without restrictions starting next Monday. I have some concerns about that because I am worried about people's public health and safety, and really am encouraging people to take it seriously and stay home unless they really feel like they need to get out to exercise and to take it seriously.
Pennsylvania also has a large elderly population, larger than the average state. I think it has the highest elderly population in the Northeast. Are you satisfied with how nursing homes, particularly maybe nursing homes that are dealing with veterans, and like how they're doing in Pennsylvania?
The short answer is no, and I do want to echo what the Lieutenant Governor and the representative said, and that is, I do think we have to make this distinction between activities that people will do outside versus what they're willing to do inside, and also crowds. It's one, and again, whether it's the right time to open up the beaches or not, you know, or for us, you know, river walks, that type of thing. But you can do that at least, and again, I'm not saying it's perfect to do it right now, but at least you can be separated from there. There's a whole different ballgame to, you know, be inside or even in a stadium. You know, we have obviously the Eagles and Steelers, the Pirates and the Phillies. We've got a ton of minor league stadiums be in a stadium with 5, 10, 20, 30,000 people. So those are completely different activities. So I want to just echo their points on that. We just announced an investigation this week on both nursing homes and veterans homes, particularly on veterans homes where older veterans who were already vulnerable to begin with because of their demographics, the death rate in one particular veterans home in Pennsylvania is catastrophic. And so we are going to, you know, we are beginning that investigation to find out how did that happen, what protocols were taken, why did it take so long for everyone to find out, why family members weren't notified in time, and how can we prevent that moving forward. And it is clearly not just Pennsylvania, although it's a pretty big chunk of our population, but the situation in nursing homes and personal care homes across the United States are an enormous challenge for both the residents of those facilities and the workers of those facilities. And you know, I'm sure I'm just saying what everyone on this conference call believes, and that is some of the heroes in this battle have been those frontline healthcare workers that really, for not the pay they should be getting more, are putting themselves at risk not having the proper equipment in many instances, or rewashing gowns when you're supposed to be using new gowns, doing that every single day. And so we're also doing an investigation there. We've been having meetings nonstop with the nonprofit side of the nursing home industry and the for-profit side of it to find out how we can get greater transparency, and at the same time find out exactly what has happened, how can we prevent it from getting worse if possible, and hopefully there's a way to make it from getting worse. But also, again, coming back to what many of us said at the beginning, this will not be the last time we go through this. We cannot have these type of deaths and this type of situation for the workers and for the residents of these facilities every time a pandemic happens. It's simply inexcusable.
There are a lot of questions that people have raised from the audience that are political, and let me sort of kind of sum it up into one meta question here. Wisconsin went to Trump by 0.7%. Pennsylvania went to Trump by 0.7%. Florida went to Trump by the relative landslide of 1.2%. How do you think Biden is doing in your state, and what's the advice you would give to the Biden campaign to Democrats in general to win your state? And let's start with Pennsylvania, then go to Wisconsin, and then go to Florida. Okay, so PA, Auditor, you're up.
So we'll start off with 2016. Pennsylvania was considered, I would say, by the public prognostications, relatively safe for Hillary. I was running for re-election. I won by about 6 points the same day that Donald Trump won by 0.7. Josh Shapiro was also elected Attorney General. Joe Torsello was elected Treasurer. So Democrats did win statewide elections, but Donald Trump won as well. So I'm going to start off with, it was a mistake because we did our own poll. We saw in my own poll, whoa, she was only, meaning Secretary Clinton was only up about a point. And it was certainly within the margin of error. So the idea that the state was salted away, and we did our poll at the end of August. So we didn't see what national people thought or even the Clinton campaign thought. So if the election were today, Joe Biden would win Pennsylvania by anywhere from 5 to 8 points. I'm not saying that happens on election day. I'm talking about if it were today. And I think a lot of that is driven by the current mood of the public and the handling of the pandemic. The biggest thing, and again, we don't know what type of environment we're going to be in as far as our ability to get out and do political campaign work along with just living our normal lives come the fall. But I believe the biggest strategic mistake made, actually what the Trump campaign did right versus what the Clinton campaign did wrong, I think, is that Secretary Clinton actually racked up pretty good numbers in the Pittsburgh area, meaning Allegheny County, and the Philadelphia area. But there was very little focus in the other areas of the state where President Trump ran up, to be blunt, unbelievably high margins. So there were counties in southwestern Pennsylvania that I lost 55-45, and Donald Trump won 75-25. Just unbelievable disparity. I won Erie County. Again, I wasn't the only Democrat that won Erie County, but I won Erie County. Trump won it by around 20 points. Luzerne County, which is a historically Democratic county.
Is that Wilkes-Barre or Scranton?
Like 15, yeah, Scranton, Wilkes-Barre area. Yeah. There are two main counties there. One is Luzerne, one is Lackawanna. Luzerne is a little bit closer, but still historically Democratic. Donald Trump won that by 15, 20 points, and I won it relatively comfortably. And Secretary Clinton barely won Lackawanna County, which is where Scranton is. Whereas, again, I was in the low 60s. And again, I'm not saying that I did anything great, but clearly he was campaigning all over the state. And I think from the presidential level, we saw efforts in Philadelphia region, Pittsburgh region. So coming back to your question, the advice is run a 67 county campaign. Knowing you're not going to win every single county, but focus on every region of the state. And even if you don't win it, you're going to do better there. I think the vice president is going to have a message that can do well in all parts of Pennsylvania. Great, nobody gets every vote, but I think if he does what Barack Obama did in 2008, which is run a 67 county campaign, the margins in some of these other tougher counties where, President Trump will clearly win it, but it will be much closer. Then you rack up your bigger numbers, Pittsburgh, Philly, and I also think my area, Pennsylvania 10th District, Harrisburg, York, Carlisle. Certainly the Allentown region has become certainly a swing area now, in the Philadelphia suburbs, where I think Joe Biden is going to put up historically big numbers. I think combine all of that together, if they do that, they win the state by anywhere between 5 and 8 points. But it's going to take hard work, and a lot of candidates running for national office get sucked into this. Pittsburgh, Philly, hope for the best everywhere else. Can't do that. You got to campaign everywhere.
Lieutenant Governor, in Wisconsin, Joe Biden won every single county against Bernie Sanders in 2016. Bernie Sanders won, I think, every single county but one against Hillary Clinton. So is that a good omen for Biden, and what does he need to do?
Yeah, I absolutely think so. And just to put it simply, what Biden needs to do is just not take it for granted. You're still going to have to, you got to show up in some sort of way. Who knows what showing up is going to look like in the next couple of months, but showing up in some sort of way, maintaining an actual presence, because as 2016 showed us, it can all just be lost and can't rely on the polls at this point. Same as in Pennsylvania, if the election were today, Biden would win Wisconsin, but that is if the election today, and the election is not today. So maintaining the presence, showing up, and obviously that name recognition is going to take him far. There's still Obama nostalgia that people have here in Wisconsin, and he is going to have to put a little bit more on top of that, though, to bring it home.
Florida. I feel like it's like Fredo Corleone. It breaks our heart every single time. Is Florida going to break our heart this time? And how does it not break our heart? Tell us, Margaret Good. Tell us how.
Not if I have anything to do with it. There are a lot of people working really, really hard in Florida. And I completely agree with the Auditor General that we have 67 counties in Florida too, and that we really need a 67 county strategy. And the Florida Democratic Party is already very clued into that and has spent a lot of time in the last 4 years expanding our network, making sure our local infrastructure is strong. And certainly the district, the 16th congressional district where I'm running there's some Sarasota, not really urban, but it's sort of urban, and then a number of suburban and some really rural parts of the district. And you have to bring up those numbers. This is a district that Trump won by 10 points, but Senator Nelson won in 2012. Like, there is a swing. If you do the work, you can win the district. And I think that's how a lot of Florida is. The message is so important, but the infrastructure is in some ways just as important. And so I think the boots on the ground and the work that the Florida Democratic Party has done is going to be really key. And my hope is that the Biden campaign will come in and be really aggressive on the ground in Florida, whether that's through digital organizing or actual on the ground work, because we shouldn't give up on Florida. I think this is the year. It's a state that we can win. If we win it, Trump can't win. Is the prevailing prevailing ideology. I prescribe to it and have I know I and a lot of other people are doing work to make sure that this is not Trump country any longer.
Well, I want to thank our guests. We've run out of time. Lieutenant Governor, I can see why you're the youngest Lieutenant Governor elected in America, and I can see why people feel that you're one of the rising stars in America. And I see two people also on the screen that would be fantastic in the United States House of Representatives. So good luck in your races as well. I want to thank the New Deal. Like I said, if you don't know the New Deal Democrats, Google them. They're a fantastic organization, and Debbie Cox Bolton has been leading it, and she's terrific and a great friend of Third Way. I also want to thank my 3 dogs, because they sometimes get extraordinarily loud at these events. They want to be part of it, but they kept their cool this time. So thank you very much, and thank you to our audience.
Thanks so much for having us.
Take care, everybody.
Thanks.